It's been a long week. Today, your Friday afternoon session begins with Jennifer, a 48-year-old woman who has 5 visits in the last year. Her visits always begin with a long list, sometimes of 7 to 10 items. Some of them are recurrent, and she leaves never satisfied. As you're about to enter the room, you wonder, how can I get the most out of this patient interaction and still feel good about seeing Jennifer today? Hi, this is Frank Domino, and joining me this morning is Dr. Jill Terrian, Associate Professor and Director of the Nurse Practitioner Program at the University of Massachusetts Medical School's Graduate School of Nursing. Good morning, Jill.
Good morning, Frank.
So Jennifer is in my practice all the time. It sounds like she's someone you see fairly frequently as well. I sometimes have that feeling of, oh goodness, here we go again. What do we know? Why does it seem that there's so much more to do for patients with less and less time?
There are a few things that we know. Patients come in with more expectations. We have less time because we have to work under certain metrics. We have to collect information in an electronic medical record, which can be distracting. We seem to have more medications, more testing, and there's a lot to be done, usually packaged in a really small window of time.
You're absolutely right. I think before we had occasionally patients come in who are for a blood pressure check, and now patients come in like Jennifer with a long list of issues. So you raised this wonderful paper. How did this paper try to evaluate best practices in dealing with patient interactions?
It came out of satisfaction, number one, both on the patient side and the provider side. People are unsatisfied on both ends. So it took a deep dive and looked at the literature on, interpersonal interactions and communication. They then looked at providers and patients in an interview and recorded them, examined the themes that came out of that. They came out with 31 practices overall from this information. They then did what's called a Delphi method, which is a reliable and valid methodology to quantify expert opinion. And it's a very involved process, but it basically came down to 5 practices that could be used to improve the connection with patients at their visits.
Great. Okay, so this complicated method took a very scientific approach to identifying key methods we can use. What were those 5 key points that they made?
Prepare before you go into the room. Listen intently to the patient. Find out what is the most important thing they are there for. Connect with the patient and explore the cues that the patient offers to help find out, is there a hidden agenda?
All right, well, those are good points. Let's take Jennifer as an example. How might you take these 5 points and apply them to Jennifer?
Looking at Jennifer, I have a relationship with her. This is her 5th visit this year. She's young, she's 48, and she comes in with these lists. So I would advise myself doing is to be mindful that I'm a little bit irritated possibly. I'm tired, it's the end of my day. I want to take a deep breath, center myself, look at what she came in for, and possibly refresh my memory with her information so that I'm on top of things before I get into the room.
I agree completely. I think we should all review patients' previous visits because there's so much that goes on between the visits, and when you're processing the visit, you're sometimes overwhelmed with information. So great, prepare before you go in to see her.
Now I'm in the room.
All right.
And I want to hear from her why she's here today, what's most important to her. There's been a previous study done where it says if you let the patient talk for 2 minutes, you've probably gotten most of the information about why they're there. 2 minutes doesn't sound like a lot, but when you have a time clicking off in your head, you can get a little bit anxious yourself. But I'm going to listen to her. I'm then going to ask her what is tops on her list today that we can deal with. And I'm most interested in trying to focus on her, not turn my back and put my information into the electronic health record. And I also want to look at her and see how are her emotional cues. How is she answering me? What's her facial expression? Are we connected in this? Are we connected in this interaction? Am I making a difference with her? Because I'm thinking I'm missing something. If she keeps coming back and I haven't solved what's going on, am I missing anxiety? Am I missing depression? Am I possibly missing abuse? It takes time to have a trusted and respectful relationship with a patient. You want it to be good. You want it to be also efficient so that you can get her back out into her life.
I think that when we have patients with many complaints, many somatic complaints in particular, we have to broaden our differential to not just think of rheumatologic diseases or cardiovascular disease. We really need to be very focused on the patient, and I love your discussion of following patient cues. I've had the patient eye roll, or I've had the patient look away when I've asked sensitive questions, and because of time or because of my own overwhelmed sense, I didn't always follow up on it. So I like these 5 points. I think preparing before you go into the room, be very focused. I love thinking, don't do anything but just listen for 2 minutes. Ask the patient what's most important to them. Revisit, especially some of the non-clinician-based information. How's your family? How is work, etc. And then follow up on those emotional cues. I think those are 5 points that I'd like to further incorporate into my care and be a better teacher of when I have students or residents working with me.
And we want to be satisfied with our patient care, and we want our patients to be satisfied with the care they get. It's so important.
So I think this is a good solution to a very common issue that we see every day. Jill, thank you so much.
Thank you, Frank.
Practice pointer. Primary care is challenging. Utilizing 5 tools within your visits can help improve patient satisfaction, your clinical practice satisfaction, and improve empathy throughout the visit. Join us next time when we talk about the role of corticosteroid injections for plantar fasciitis.